And it is 1 o'clock, so I will call this meeting to order. We are going to be missing Councillor Nielsen today, and I understand Warden Matrosovs will be joining us in about 20 minutes, but we do have quorum and are able to proceed. Before we get started with the agenda, the first item of business today will be electing a chair and a vice chair for 2025. And I note Councillor Nielsen has joined us, so welcome, Councillor Nielsen. That's a surprise. Expecting your absence today. So are there any nominations for chair of the committee for 2025? Any nominations to put forward for chair for this year? It's a one-year tenure. Councillor Hutchinson?
Good afternoon. Thank you. I would put forward Councillor Scott Mackey for the chair.
Okay, thank you. Is there a seconder for that? See Councillor Carlton. Thank you. Are there any other nominations for chair of the committee for 2025? Okay, seeing none. Can I have a motion to close nominations? Councillor Patterson, Councillor Hutchinson, thank you. Councillor Mackey, would you like to have your name stand for chair?
It would be my honor, Tara, but for the record, I just would like, I know the question was asked of you prior to the recording, in regards to the terms of reference and the length of time someone can be the chair. I'm not outside those limits.
Correct. My understanding is that the chair can, it's an annual position, so it can continue on to a maximum of 4 years. And I would consider that to be per term of council, having a new term of council reset that position again.
Thank you.
Okay, sorry. And I'm just, Braybird, thank you for setting the terms of reference outline. So the term of office for committee of management is a maximum of 4 years and follows the term of county council. And you can be reappointed for successive terms.
Thank you.
Okay, so with that, you are acclaimed as chair for 2025. Now to the vice chair position, which is also a 1-year term. Are there any nominations for vice chair of the committee for 2025? Councillor Mackey?
Thanks, Tara. I would nominate Councillor Patterson to return as vice chair.
Okay, and is there a seconder for that? I see Councillor Keaveney. Thank you. Are there any other nominations for vice chair of the committee? Seeing none, can I have a motion to close nominations? Councillor Carlton, Councillor Hutchinson. Thank you. Councillor Patterson, do you wish to have your name stand for vice chair?
Thank you. I would be honored.
Right, excellent. Thank you. And you are acclaimed as such for the year 2025. And at this point, I will pass it over to you, Chair Mackey, to continue the meeting. Thanks, everyone.
Thank you, Tara, and thank you to the committee members for your ongoing support and your confidence in me as your chair. So we will call this meeting for January 5th, the Long-Term Care Committee of Management to order. Just to remind members of your obligation to declare a pecuniary interest or an interest. Seeing nothing, if anything should arise, you may declare it at that time. Our first report is our director's update from November 1st to December 31st, 2024, and that is LTCR CM 01-25. And I'll turn it over to our director, Jennifer.
Thank you, Chair Mackey. Congratulations to you and Councillor Patterson on your executive roles, and Happy New Year to committee. It's not surprising. There is no shortage of updates to share with committee in the land of long-term care. So I've just pulled my notes here in front of me, and I'm just going to touch on some of the highlights in the director's update. There were a number of ministry updates that I wanted to just draw some attention to. One in particular was a memo talking about a pilot related to cultural specific homes and waitlist prioritization. And so this is something that our association, Advantage Ontario, was advocating for, and we're pleased to see that the government is looking into the legislation around waitlist management and prioritization. And while we don't operate culturally specific or ethnic, religious, or linguistically appropriate specialized home, we do operate the Behavioral Support Transition Unit. And with the BSTU, there can be some challenges in the transition out. So when an individual is ready to transition back to traditional long-term care, the current legislation around wait lists make it challenging for someone to make it onto the priority list to be able to transition to traditional long-term care. So we've successfully transitioned individuals to traditional long-term care within Grey Gables itself, but have not yet successfully transitioned someone to traditional long-term care at another long-term care home. So we're keeping an eye on this pilot, and when there's opportunity to provide feedback into potential changes to the legislation, we'll watch for that and take the opportunity to participate in that. And this is really promising, I think, in terms of opportunities for individuals that need specialized care for a shorter period of time and then can benefit from traditional long-term care. There was a couple of other memos following up regarding changes to the regulations and act, the Fixing Long-Term Care Act, and we've linked some of the updates there. In November, there was a memo regarding screening measures and guidance for long-term care homes, and this is specifically around the regulated requirements for police record checks and vulnerable sector checks, and some information around tuberculosis screening as well. And we continue to work with our partners in law enforcement to interpret the legislation in the same way and be sure that we are getting the vulnerable sector checks that we are legislatively required to in a timely manner. And there's a bit of a backlog in the system, and so that can prove to be a bit of a challenge in onboarding new staff. So we're working through that. There was another memo in November around this was a really exciting update in additional funding for the hiring more nurse practitioners program. And we have successfully recruited 3 nurse practitioners within our organization. And this is really helpful in terms of supporting the funding to be able to support that program. So that was exciting. Another kind of new and exciting legislation or proposed legislation is the Enhancing Support for Seniors and Their Caregivers. And this was released just before the government went on break. And so we haven't got a lot of updated information about it. But again, we're keeping a close eye. This legislation really aligns with our philosophy of care in Grey County long-term care. I'll just highlight one of the funding bullets is $9 million over 3 years to launch a new program to train staff in emotion-based models of care. And our Color It Your Way philosophy is an emotion-based model of care. And so we're watching for opportunities to even participate in what that program looks like and watching to see if we might be a part of influencing and perhaps be a part of the development of that new program. So stay tuned. We're keeping an eye on that. The next update was...
Jennifer?
Yes.
Excuse me. Could I just in regards to that, I think I read somewhere in regards to seniors that require an added level of care being able to access long-term care facilities for, bathing and for specialized supports. Do you have any more information on what that would mean to our three homes and how we would implement something like that?
My understanding, and I'll look to my colleagues who've also perhaps been to some of the information sessions. There's not a great deal of information. My understanding is that there are certain areas in the province that are have been identified first to look at what this looks like, and that some municipalities and other organizations that offer long-term care service already offer some community-based service where this funding would support that linkage of the long-term care home that they operate being a site for someone that's receiving that community service to be able to come in and do bathing, and kind of like the day away program. In fact, two of the day away programs already in Grey Bruce operate some of their services out of Lee Manor and Grey Gables, and that is some of the out of those buildings. They don't use our spas or our services, but they are housed inside of our buildings and offer some of that support. So my understanding is it's looking to expand that and what that looks like. Dane, I'm not the chair. Chair, back to you, Chair Mackey.
Thanks, Jen, for that update. And we'll go to Councillor Nielsen.
Thank you very much, Chair. Just a follow-up question. We're developing Rockland right now, and obviously this is new legislation versus we're well down the path. Is there any comments you have onto how the new design of Rockwood Terrace may fit or may not fit what the province is suggesting here?
Sure, and through you, Mr. Chair. I do chair lots of other meetings, so I had a little bit of a lapse there. So through you, Mr. Chair, I don't know at this point. There's a few things going on that we're all paying attention to. One of the other opportunities that we've heard about through Advantage is called Nursing Home Without Walls, and this is a program that is funded and operated out east, and I just can't remember if it's Nova Scotia or New Brunswick, and it's a similar idea. And so I think we just watch and look for opportunities in terms of the current building or the new building. I don't know that there's anything that would prohibit us with the new build from looking at what's possible. One of the other items that I'm not certain of that might be an opportunity is teams of staff that work in the long-term care home going out to the community to the seniors as opposed to the seniors coming to the building. So I think that there are lots of opportunities and potential options.
Thank you.
All right.
Not seeing any other questions. You can carry on, Jen.
Okay, thank you. So I'm just looking ahead to highlight a couple of other initiatives. So there was another further incentives that were released around December 6th for personal support workers stipends and recruitment incentive programs. And so these are all articulated here in the report, and I'll let you have a look at it. And just to let you know that we're working with our partners in HR to make sure that any of our team members that are eligible for these incentives from the province are receiving them. So we are supporting them with whatever paperwork that they need to do to be able to receive those bonuses. On December 12th, the ministry released the Celebrating the Holiday Season Safely. So it's our annual reminder about how to be safe in long-term care. And that was followed by the planning for respiratory illness season preparedness. We also held a family, sorry,
Jen. the incentives, are we anticipating, because it's only Rockwood and Gray Gables that are eligible for the incentives, is that correct? Will there be any impact on Lee Manor because of those incentives? They have to be rurally based. Is that accurate?
There are some specific ones that are rural, but there are other incentives that are if you are a new PSW and you're working in long-term care. So we have had new PSWs in all 3 homes, I believe, receive these incentives. I don't know, Jen, if you know off the top of your head about that, but the rural, remote, and northern is a new one that is in addition to some existing incentives. So there's a number of programs out there, and we watch to make sure that people who are eligible are receiving those bonuses.
Thank you. Jen, go ahead, please.
Through you, I don't know the answer off the top of my head, but I'm happy to research and get back to the group at some point, whether it's your next meeting or whether we send you an email.
Sure, next meeting would be fine. Thank you. All right, Jen.
Thanks, Jen. We can include an update about that with some numbers. It'd be nice to see how many people have benefited from that. We held a virtual family call at the beginning of December, and the link to the call is there if you are interested. Rob and I are a dynamic duo for virtual family calls, so it would be 40 minutes of your time well spent. In terms of staff and training, we continue to work with our partners and in HR and in recruiting registered nurses, registered RPNs and PSWs and food service workers. We had a leadership day in November with all of the leaders from the 3 homes. And it's always a great day to bring everybody together and to share information and network and learn together. And the focus of that day was around creating a just culture and a focus on our quality program. And something new that we did this year that was really exciting was we did a call out to leaders to share a success story that they were really proud of that furthered our quality care and service in their home. And we were able to highlight a number of success stories where those leaders shared their story, the project or the initiative, how they implemented it and what the outcomes were, and they shared that with their colleagues. So we were learning together, and so there was some discussion about what drives the RIE scores, and so RIE is what drives the CMI and how we document and the care and service. There was a feature about Rockwood Terrace redevelopment. There was a feature about a meal suite program, which was how we improve at the dining experience using technology. Lean on Me huddles is a success story out of one of the homes where they have a specific huddle following the passing of a resident to share stories and talk together and celebrate someone's life and support each other and do a bit of a debrief. And the PrEP LTC student placement program was also featured, and we will bring a highlight about the PrEP LTC program to an upcoming meeting, and I've got a couple of other comments about that at the end of the report. We also have an initiative happening right now with a third-party educator, Deborah Bakhti, and it's focused on the relational approach, and it's called the TRAIL program. And we have representatives who have expressed interest in being a part of this program at each home that come together and do an hour virtual training and then go away and do some work in the homes. And it's all focused on enhancing and improving the relationship and the connection with our residents' families. and ensuring that residents' families are a part of the care team, and equipping our team members with the tools to be able to support resident families, but also the tools to work through situations where there are challenges or concerns or some contention, and how we do that. And so there's 2 more sessions of that program. And finally, we were excited to welcome Drake Hall to his new role as nurse practitioner, supporting Rockwood Terrace and Grey Gables. So we welcome Drake to the team. A little bit of an update on Accreditation Canada. That we're currently working through the accreditation process, and at the end of 2024, Accreditation Canada updated their standards, and so we're refamiliarizing ourselves with the updated standards. And we will be the next steps is that we will be releasing the Global Workforce Survey in the coming months. That's an important part of the process, is getting feedback and input from our team members, and using that information to create action plans and work through the next steps. Wellness continues to be a feature and a focus, something we focus on just generally in terms of employee wellness. And this just highlights that we have released, in this quarter, we released the staff wellness newsletter. And partnerships. Again, I want to highlight that the leaders that you see on the screen and their teams continue to be sought after experts in the field. And Grey County's Prep LTC student coordinator was recently invited to speak at the CLRI Coordinator Connection meeting in December. And she provided an overview that focused on how we worked through the Prep LTC program. And they've also highlighted some of our work on their website, and it's linked here. We have a draft of the BSTU interim report, and we'll be submitting that to the province this month, and then sharing that information at the next Committee of Management meeting. And finally, in terms of partnership, I will just provide an update that I have been a director on the Advantage Board of Directors, the Advantage Association Board of Directors, and as of Monday have been elected by my peers to fill a vacancy of vice chair. So I will be vice chair of the Advantage Board until May of 2025, until this May, and then we'll see, we'll go from there. And that is my update.
Jen. Congratulations.
Thank you.
Well deserved. Questions from committee members? Not seeing any, so the chair will ask one more. The Lean on Me, that huddles that you referenced, Jen, is that a program that we are doing in all 3 of our homes? When you talk about a celebration of life, that's really important for, the other residents that will have established some, pretty strong relationships. So can you just, maybe I'll look to the executive directors or you, is that a program that we will further develop, or do we already have it going?
So there's actually 2 things. So celebration of life for residents, for other residents, are happening absolutely at all 3 homes. The Lean on Me program has started at Lee Manor, and I'll look to Tallene. Is it also when there's been a challenging situation that the team comes together to support each other, or, and I may, because I'm concerned I might have had some of the details slightly off.
Totally.
Sure, sorry. Through you, Mr. Chair. So yeah, we started the Lean on Me about a year ago, and it is to support the staff through their own grieving process when a resident passes away. We become very close to the resident. We're an extended family for them, and so we felt it was really important. And the staff have really embraced the idea, and they come up with creative ways to acknowledge and honor the resident. In terms of incidents or issues that aren't related to someone actually dying. I think, Jen, in all the homes, we do those sorts of debriefs if we have a situation that is particularly challenging or ethical, like helping people work through a process, if that's what you meant, Jen, I think.
Yeah, thanks for that.
Yeah.
Great. Good to hear. All right. And I probably messed up right at the beginning of, I didn't have a mover to get this Jen's report on the floor. Could I have a mover, please, to get it on the floor? Moved by Tom and seconded by Sue. Thank you. And not seeing any other questions, all in favor of receiving the report? That is carried. Thank you. Our next report is the LTCRCM 0225 long-term care operational report dated October 15th, 24 to December 14th. Be received for information. Can I have a mover, please? Moved by Shirley and seconded by Sue. Thank you. And Jen, are you starting off or are we? Go ahead, please.
Chair. I am starting, but if I can give you the short rundown if you want to write it down, but I also can just interject whatever's easiest for you.
Why don't you just take it from here and throw it out to the executive directors as you see fit.
Okay, excellent. Thank you. So thank you. This is our operating report for the period of October to December. So I'm going to start with the quality section. And for those of you that, I don't think Warden Matrosovs is here yet. So all of you were part of the discussion in November, and we had a really good discussion about quality and the publicly reported indicators and our work moving forward. And so as staff, we took back some of those items in the discussion and looked to our report in terms of how we can provide a little bit more information to make this section a little more robust. So you'll see that it's been updated, talking about our quality assurance program. And for the work that we do, we have this purple kind of, or our maroon language attached to all of our agendas and our meeting minutes. So when we're meeting and we're talking about making decisions around change or implementing something new or stopping something or looking at quality improvement, we always ask the questions to determine whether it meets our color at your way philosophy. Is it leading practice or best practice? Is it equitable and reliable? And for us, equitable and reliable means that if we make this change at one home, we could make the change, or in one department or in one section, that we could make that change across the organization and expect the same outcome at all three sites. And so we don't want to make a change that works for one and doesn't work or causes harm or risk in others. So is it equitable and reliable? And does it color it? Does it color it for the people that work in our homes and the people that live in our homes and the people that visit? And this is all based, our quality assurance program, it's a systematic, continuous actions focused on those things, the people, the processes, and the systems that make up Grey County long-term care. The framework is all based on the Color It Your Way promise. It's the foundation of all that we do. And it's multifaceted. So historically, this section had just the publicly reported indicators, and those are really one piece of the quality puzzle. So our quality program is made up of the quality and risk management policies and procedures, our strategic and operating plans, our quality improvement plans. The manual outlines what those quality and risk management activities are that track, assess, and support the analysis of the work that we do. Other things that support that are incident reporting, tracking and evaluation, annual program evaluation. So under the Fixing Long-Term Care Act, I meant to go count, but I think there's about 16-ish, 12 to 16 programs that legislatively we're required to do an annual program evaluation on. And it's quite structured. We need to be looking at what the goals were for that year. Did we achieve them? What analysis have we done? What trending have we done? And what are our goals moving forward? Complaints management supports our quality program. Accreditation is a nice third-party test of our overall program. Resident, family, and staff experience surveys, the Ministry of Long-Term Care inspection program, and the publicly reported indicators. So we have a very robust program to support our quality work. And so that brings me to the charts, the publicly reported indicators. And unless there's a desire to be talking about this in great detail, then the charts and the numbers that you see today, when we were discussing the charts in November, these numbers were already in place. These were the numbers. This chart reflects the numbers that were in place when we were talking in November. So it wouldn't matter what level of change or work we've implemented between November and today, these numbers we couldn't change them. The change on these charts will show 3 quarters from now. So we'll be able to use this section of the report to report back to committee the work that we're doing, and the publicly reported indicators aren't going to start changing until another couple of cycles, if that makes sense. But however, they are here, and there's some verbiage included with each chart in terms of what each home is focusing on and what they're working on. And then I wanted to highlight that the resident and family experience surveys from 2024, those results were received in October, and just highlighting a few of the feedback and results from those surveys. 93.5% of residents and families, this is a rolled up number, are satisfied with the quality of care, and 92% would recommend the homes to others. Those are indicators that we have been asking for a number of years, those questions, so that we can do a look back to see how that's going and whether there's opportunity for improvement. And the residents, I like that we ask that we use a third party to support this work, and I like that one of the questions is, what are the top 3 words to describe? And the residents say good, caring, excellent, friendly, comfortable. I guess that's more than 3. And then families are around quality of life, environment, communication. Oh, sorry, these are our areas for the top 3 areas of satisfaction are quality of life, environment, and communication. And the top 3 areas for improvement are dining experience, care quality, and care responsiveness. And we've linked the overall summary of the experience surveys there for you or the public to go and have a look. And at each home, the leadership meets with the residents and family council, and they go over an action plan and create an action plan and post it. And that is another part that makes up our quality program. And I see a question, Chair Mackey.
Shirley, go ahead, please.
Thank you very much, Chair Mackey, and congratulations on your reappointment. Jen, I just wondered if I could ask in relation to the thought that a dining experience could improve. I mean, when we were at Grey Gables and had the lunch there, it was really quite impressive. So I'm just curious to know if you could share some of the feedback in relation to the dining experience and how residents see it and what their thoughts would be for improving it.
Sure, thank you. Through you, Chair Mackey. So these are the areas that are opportunities for improvement, and I didn't highlight them in the report, But even as an area for improvement, there is still, I think the lowest was 79% are satisfied or very satisfied with the dining service. So again, it's a small percentage of respondents that felt there was areas to improve. Having said that, congregate dining is not something that we do every day. Many of us really like to go home to our own house in our quiet dining room and eat whatever we want. And that might be toast and eggs, or it might be a fancy meal. When you move into long-term care, those options aren't there in the same way. And so there's always opportunities around, some of the feedback is often around the noise and volume in the dining area. That's something that can be worrisome. Your dining mates, you don't always, we work very hard to support people to sit at a dining table with people that they want to sit with. It doesn't always work out that way. And the way I make potatoes might be different than the way Dena makes potatoes. And so those are the types of things that we look to support each individual with their specific needs, while at the same time preparing a meal for 150 people. There'll be some learnings with the new Rockwood Terrace. That building uses a different type of meal preparation and dining service. So there may be some opportunity to learn, see how that goes, to see what the options are in order to transition that into the other two homes. So it'll be a good test. We're quite hopeful. The system at the new Rockwood is proposed to be, we won't get into the technical details, but it's still homemade in the home, and it's flash frozen and then brought up to heat in a special device. So like I'm not a nurse, I'm also not culinarily skilled to know all the fancy words, Karen, but there's a fancy word for the equipment that does that. And that opens the options for people to be able to have more than two choices without the risk of the waste, right? So in the traditional sense, we always offer two choices for meals. And then there's a short list of things that we can do if the two choices don't satisfy someone. And that's things like a sandwich or things that are kind of easy and quick to make. So there's some room there. But each home will have their own feedback from their own survey that they'll use to target action items for change. So whether it's noise in the dining room, or the speed with which things are delivered to the table, or other items like that.
Okay, Shirley.
Thank you. Sounds like we're working towards a fine dining experience.
That's the
Good work,
goal.
Jen.
That's the goal.
Well, it certainly sounds better than what I'm accustomed to, Jen. So I keep doing the good work.
Thank you, sir. One thing that I didn't highlight, and I'll just in the cognizant of time, this just above the publicly reported indicators in this section of the report, there's a link to the strategic plan, and it's a one-page visual diagram. And I encourage you to go have a quick look at it when you have a chance. That is our kind of one-stop shop for us as leaders in terms of what our strategic vision is. And we bundle our vision into the three areas of being at our best, delivering the best, and getting the best, all underpinned by our promise. And each year when we meet, we look at the bullets underneath each of those sections, and that's an umbrella in terms of capturing the work that we want to do. And then each home, the leadership, the executive directors meet with their leadership team, and they set home-specific goals and priorities that support this vision. So we're well on our way to the evolved quality program and moving things forward, always in the goal of improving the experience for the people that live and work in our homes. So I will leave it for any other questions, and then we can hand it over to Dana for the clinical update.
Not seeing any other questions. So Dana, go ahead, please.
Well, hello there and Happy New Year. And through you, Mr. Chair, I want to give you an update on our diabetes management program. And by way of an introduction, for any of you who've experienced it or family members, managing diabetes is challenging, and in the long-term care setting, it's essential for us to provide a comprehensive, quality, resident-centered care approach. And certainly with the incidence increasing of type 2 diabetes among older adults, managing this condition in long-term care presents unique challenges. So our diabetes management program is focused on providing personalized quality care for our residents. It's a holistic approach that includes medication management, along with ensuring proper nutrition, ensuring physical activity, and ongoing monitoring, while also considering individual needs like mobility. For our residents who have diabetes also have cognitive impairments or other coexisting conditions. So very complex. So collaboration is key with our healthcare providers, such as the nursing team, our physicians, our nurse practitioners, dietary staff, and others. That's all key to addressing our residents' changing needs and reducing complications. And I'm grateful, and I see it every day I'm in the homes, that the most subtle changes of our residents can be recognized by our team members. PSWs who know them best can flag the need for action at just a subtle difference, where things appear that they need to do some follow-up, and we're quick to action. And this fall, along with our nurse leaders and medical directors, we reviewed all of our diabetes management policies to align with our current best practice. And we're grateful, as Jenna shared, that we have 3 nurse practitioners who are very good at clinical assessment, and having them in our homes and face-to-face with our team members has been very helpful. And we have 1 nurse practitioner with extensive experience in diabetes management that has been heard the depth that she has in managing diabetes has been wonderful, and is supporting all of our registered staff to receive in-person extensive training, asking those questions on the spot, as well as those very simple questions that can be answered by an expert, and recognizing what we need to do. So we've been really successful with the implementation of our policies, and ultimately I think we're going to see even more enhanced resident outcomes in this area. So we've noticed it already. We are all very well versed in diabetes management. I've learned a lot myself through the experience of that nurse practitioner. And so the other clinical update I want to give you is in regards to how we are using the Boomer program. Do you want me to pause now, Chair Mackey?
Sure. I think we have a question from Councillor Patterson. Sue, go ahead, please.
Thank you, Chair. Thanks, Dana. Remind me again how the testing is done, how it's completed for diabetes. Is it a blood test or a monitor? I forget.
Oh, well, it's a lot of things, but absolutely we have a variety of ways for which we monitor our residents. Some, as you know, have the device, the monitor system. We can also do skin prick tests, but it really depends, and that's where the individualized care and actions. And then we have medical directives in place to support our staff members if they need to act, sort of that ongoing monitoring versus acute monitoring. So it depends on the resident how that happens. And there's also annual testing, there's upon admission testing, there's routine testing. It's a variety. It hits the whole spectrum. Did I answer that question?
You did. Thank you.
Yes, it totally depends. And there's, what somebody with type 1 diabetes versus type 2 diabetes. So, and that's why our policies are pretty extensive.
Good. Thank you.
Thank you. And through you, Mr. Chair, on with the second part of my clinical update, I wanted to share about the Boomer program. And that's in regards to how it's been used to support medication reconciliation when a resident moves into their home. So medication reconciliation is a crucial safety initiative aimed at reducing preventable errors during transitions in resident care. Those are the peak of where medication errors with the change in communicating can happen. Many residents come with medication orders, perhaps from a variety of practitioners. They may also be taking herbal medications at home, etc. So there's a variety of medication that they may be receiving. And some may not always take as it's ordered. So this is a time of transition. Getting the medications right is vital. So during the transition, healthcare providers need to work collaboratively with the residents, their families, and other care providers to maintain an accurate and comprehensive list of all the medications. So the Boomer program, which stands for Better Coordinated Cross-Sectoral Medication Reconciliation, that's why there's an acronym, supports medication reconciliation for new residents. So it's done in partnership with our CareRx pharmacists. And it's done virtually. So the CareRx pharmacist reviews the medication records from the previous facilities if they are coming to us from, let's say, a retirement home or a hospital, or if they're from the community, it would be from their community pharmacy. And the information from the residents and the family members and their previous practitioners, so that the CareRx pharmacy looks and resolves any discrepancies. Maybe one order says twice a day, one order says once a day. The resident and family say they take it every other day. So those are some opportunities to resolve any discrepancies, look at some potential overprescribing that may be happening, and then coordinates with our physicians, nurse practitioners, and the registered nurses to finalize the prescription so we have the best medication record to support our resident coming in. So we implemented this program. It won't be the first time you've heard of it. In 2022 as part of our quality initiative with most residents. We just evolved and transitioned to where almost all of our residents are participating in the Boomer program upon move-in. And I wanted to share with you our reports that we're receiving. And so there was some sample reports attached to this operational report from July to September that shows the discrepancies that have been identified upon move-in, medication that we've been able to stop. And that's, again, from a polypharmacy approach. And it also shares how the pharmacy-led approach and this coordinated collaboration also saves time because we're doing it all at once and in partnership. So anyway, you'll see that with those attachments that there's been some good quality improvement upon medication reconciliation. Any question?
Thanks, Dana. Any questions for Dana? I'm not seeing any. Thanks very much. Jen, who's next?
Tolleen.
Tolleen, welcome.
Thank you very much, through you, Mr. Chair. So today I was going to talk about the compliance reports and the critical incident section of our report today. They're linked closely together for sure. So this reporting period, we did have some compliance inspections to report at both Grey Gables and at Lee Manor. There's also, Lee Manor also had a previous report from the previous reporting period where we didn't have the public report yet, so that's included in this document, and the same for Rockwood. So Rockwood also had a report from the previous period that we didn't yet have the public report available to include, so they're included in this document. So I would just like to remind committee what the ministry does when they come. So the ministry visits our homes basically for 3 reasons: to follow up on a complaint that may have been called into the ministry directly, to follow up on the critical incidents that we self-report to the ministry based on the specific criteria laid out in the legislation. And thirdly, they come to complete a proactive inspection, which is sort of they come in and they just want to look at everything. So those are the 3 reasons that they basically come in to inspect a home. So they came in to see Grey Gables. They were here for about 5 days. So as I said, when they come, they might be 1 inspector, might be 3 or 4, depends on what they're doing. And they're usually here for several days. So They were here for 5 days in November to inspect on 2 critical incidents at Grey Gables. One was related to a COVID outbreak, and the other one was related to an allegation of resident abuse. So when they do their inspection, they follow pretty stringent criteria that they look at for all the different types of critical incidents or complaints that they might be looking at. And so for these 2 items at Grey Gables, they did leave areas of noncompliance, and they call these written notifications. So we had 2 written notifications at Grey Gables, one related to training, where it was identified that a PSW, excuse me, had not received specifically training on our abuse prevention policy. And the second item was related to IPAC, where it was observed on, I believe, on one incident that PSW did not follow the appropriate PPE requirements for a resident who was isolated. And for all of these written notifications, the homes have obviously either taken action immediately and corrected it, or working on an action plan, and it's been corrected since. And then at Lee Manor, the inspectors came to follow up on several critical incidents that were related to falls, IPAC, and allegation of abuse. And they were here as well for 5 days. So we did receive 3 written notifications at this visit. 2 of them were pertaining to falls. So one was related to really a communication issue around a resident's transfer status had been changed, and was just miscommunicated on shift change. And the second item was related to not following the care plan for safety checks for falls. Excuse me, I'm sorry, I'm getting over a cold, so I'm sorry if my voice is a little rough. And then the third WN that we had was again related to IPAC. And so that was, again, the ministry has some guidelines. We're required to follow those guidelines, of course, and there's a particular audit that is expected to be followed, but actually the language is a little bit vague. And to be honest, we have done some follow-up with the ministry around this topic, because they didn't specify in the guideline document that it was this particular audit that we had to follow. But the inspector indicated that we hadn't followed the guideline. So we have a WN on it. We have done some follow-up with the ministry. At the end of the day, we certainly had not followed the particular audit, but audits were being completed. So anyway, we'll certainly do that particular audit that they want us to do, which is not a problem. And as I said, everything has been followed up on across the homes. Is there any questions about compliance?
Committee members, any questions in regards to Tolene's report or section of the report? I'm not seeing any Tolene.
Okay.
Thank you very much for that update.
Thank you.
Jen?
Excuse me, I'm sorry.
Thank you. And over to Shannon.
Welcome, Shannon.
Thank you. Through you, Mr. Chair. Good afternoon, everyone. I'm reporting today on the Health System Partners, Environmental, and the Risk section of the report. This reporting period, 2 of our homes were visited by the Ministry of Labor for inspections related to recent outbreaks, as well as follow up to the Slips, Trips, and Fall campaign. Additionally, Rockford Terrace underwent an inspection by Public Health with a focus on the kitchen and the hair salon. I'm pleased to report that all inspections resulted in no findings. This reflects our strong commitment to maintaining high standards of safety, compliance, and operational excellence. Each year, our homes are required to submit an attestation for the Ministry of Long-Term Care. This form confirms that all requirements under Section 268 and 269 of the regulations pertaining to emergency planning have been fully met. These requirements include completion of the emergency drills, implementation of contingency plans for staffing, residents, and isolation procedures, and assurance of overall preparedness. These attestations were successfully submitted during this reporting period, demonstrating our ongoing commitment in regulatory compliance and emergency readiness. Grey Gables reported 3 risks this reporting period. 2 of these involved visitors who experienced minor injuries after falling in their parking lot. Our risk management process ensures that we address some such incidents thoroughly. In these cases, we reviewed the snow maintenance program, weather conditions on those days, and the performance of our snow removal contractors. Maintaining strong relationships with our contractors and proactive planning is the key to minimizing our risks. Risk management is a key factor of our day-to-day operations. To ensure our oversight, we have developed a comprehensive color report, often referred to as the weekly operating report. This report supports preparation for partner visits or inspections and allows us to track various operational and risks factors. So some of the parts of this reporting structure is the risk management schedule, good news stories, complaints, critical incidents, community risks, emergency preparedness, any ministry or agency visits, outbreaks. We look at immunization and education we track. We track our labor management, so any grievances or anything, and HR data. So this structured approach reinforces our commitment to addressing risks and enhancing safety and maintaining operational excellence across our homes. Thank you.
Thank you, Shannon. Any questions from committee members for Shannon? Not seeing any. Jen?
Thank you. And if I might, Mr. Chair, I'll just add, just highlight that in past reports, and particularly during COVID, during the pandemic, we had a separate section for outbreaks where we listed out paragraphs of information related to the outbreak. Those are a critical incident, and so we've rolled them into the critical incident chart and are not featuring sections about outbreaks. If there's something that we feel committee needs to be their attention drawn to for a specific reason, we'll carve it out, but we are rolling that information into the charts that are there. So that's a little bit of a change. It was starting to become quite repetitive information that we didn't think needed to be highlighted specifically.
I think I speak for the committee members, Jen, that you and the senior staff have always been providing us with the necessary information. So I don't think there's any question there. Thanks.
Good, thank you. We'll pass it over to Karen to wrap up the highlight.
Thank you, Mr. Chair, and good afternoon,
Karen.
everyone. Hi. Resident and family council meetings continue as required in all of 3 homes. Updates at those meetings included discussion related to situational masking, survey results, program reviews, quality improvement programs, and of course, introducing new team members. All homes continue to color it for residents and potential residents, and sometimes perceivably small things can make a big difference. Providing a vessel to collect prized goods, building a snowman, and helping 2 people get to their home of choice are just a few of the moments from the past couple months. That's it for me.
All right. Thank you very much. It was nice to see those 2 residents be able to get their first choice and move back and forth. I think that's the first time I've seen, it's probably happened before, but first time it hasn't happened before.
No, legislation just opened up to allow that. So it's relatively a new experience.
Oh, well, it's unfortunate you need legislation to make common sense decisions, but
True.
No, that was nice to see. And any questions for Karen from committee members? Not seeing any, thank you. And that is the end of those updates. Can all in favor of receiving that report? That is carried. Thank you. And Tara, we do have closed meeting today.
Yes, there is one scheduled closed meeting matter to discuss today.
Okay. I have a motion that the Committee of Management now goes into closed session pursuant to Section 239, subsection 2 of the Municipal Act, as amended to discuss organizational enhancements, personal matters about identifiable individuals, including municipal or board employees, and labor relations or employee negotiations. Can I have a mover, please, for that? Moved by Councillor Patterson and seconded by Councillor Carlton. I couldn't just say Sue there. So all in favor of going into closed session? That is carried. Now, is everyone remaining? Tara?
No, communications and myself will work on moving staff out, and then we'll keep the relevant staff in for the closed meeting portion.
All right,
Just
thank you.
give us one moment to pause.
Thank you. We are now back in open session, and I can confirm that while in closed, we only discussed items about personal matters about an identifiable individual, including municipal or local board employees, and labor relations and employee negotiations. Is there any other business from any committee members? From any members of the senior staff? Not seeing any. Next meeting date, Tara, is that scheduled?
Yes, I believe it is March. Sorry, I want to say March 5th. Is that right? Just give me 1 second here.
I think
Sorry.
it's March 20th. But...
Sorry, it
Yeah.
is March 20th at 2 p.m.
Is that in person?
We are anticipating the next few meetings being our typical Zoom meetings, and then likely when we move to budget discussions or some facility tours, then we would have in-person meetings. But as of now, the next one in March will be Zoom.
Because we had one facility tour canceled, right, because of an outbreak.
Mm-hmm. We think it was Rockwood Terrace, and I believe we're looking at scheduling a tour for Rockwood Terrace specifically in the summer, I believe.
Okay.
Yeah.
All right. Well, if there is nothing else, just before we close, I'd just like to thank all of our long-term care staff for your continued efforts towards quality long-term care, and thank you to committee members for reaffirming me as chair, and we look forward to the next year and continuing to have what is the most important committee of the county meeting on a fairly regular basis to make sure that our seniors are supported. So can I have a motion to adjourn? Moved by Dane and seconded by Tom. All in favor? That is carried. Nice seeing everyone. Take care. Meeting is
Thanks,
adjourned.
everyone. Bye.